Hello all, this is Mrs.Lalithamani.D, Professor from SNS College of Nursing. Here in this lecture series, we were learning about a disease condition called as cataract, which comes under the eye disorders of adult health nursing 2. So when we see that the cataract is a common condition which will be happening among the older adults, and it may also happen in the younger generation. In the previous lecture series, we have seen about the causes overview and how the lens looks like. Now we will be seeing about the symptoms of cataract, how the common symptoms are being represented in the patients with the complaints of cataract. So the common symptoms include blurry or cloudy vision, difficulty seeing at night or in low light, sensitivity to glare and bright lights, faded colors or yellowing of vision, frequent changes in glasses prescription. So in detail we will be seeing now. So blurred and cloudy vision. Blurring happens because the light rays are not passing through the translucent lens, but the lens has become an opaque one and the light becomes scattered. So the clarity of the image, what they see, is not clear, is not achieved. So the person will be having a hazy vision or hazy understanding about the object. So second one is difficulty seeing at night or in low light. So why? Because the excessive light makes the patient to understand or accept that there is some object similar to that. Sensitivity to glare is also seen, and faded colors or yellowish of the objects. Always it will be some cloudy like appearance, yellowish tinge will be present. Frequent changes in the glass prescription because the powers they become changed. The next one is the types of cataract. So the main types are nuclear cataract, cortical cataract, subcapsular that happens in the posterior region, and congenital. There are four main types. One is nuclear, it affects the lens center, common in aging process. Cortical, white wedge-shaped opacities at the lens edges. It happens only at the lens edges. Posterior subcapsular, it affects the back of the lens, impacts the retina. So posterior capsule is the one which holds the lens. Posterior subcapsular means it affects the back side of the lens and it impacts the retina. Congenital is present at the childbirth itself or during early childhood. So when you see the images being depicted in this slide, you can see the normal lens will be transparent. So the cortical type is like a wedge-like opacity, so will be seen, and congenital, secondary one, traumatic, and also there is posterior subcapsular. So when talking about the risk factors for this cataract, the age over 60 years increases the risk significantly. Age over 60 years increases the risk. Family history of cataract, prolonged UV exposure without eye protective gears or goggles, smoking and poor diet, low antioxidants. Smoking and poor diet also is found to be a risk factor. And certain medications include long-term corticosteroids. So these are the risk factors. Apart from age and family history of cataract, smoking and poor diet with low antioxidants is also proven to be a risk factor. Certain medications like long-term corticosteroids given for any other condition management will be a predisposing factor for cataract. So far in this lecture series, we have seen about what will be the symptoms of cataract, what the blurry vision, cloudy vision, or difficulty seeing at night or in low light, sensitivity to glare, bright light, faded colors. So when we have all these symptoms, the risk factors are the age over 60 years, family history of cataract, that is prolonged exposure to UV rays without appropriate eye gears, then smoking and poor diet which is low in antioxidants, and the last one will be certain medications like steroids. So until now we have seen about the symptoms of cataract and the types of cataract, what are the four main types of cataract, and we have seen about the risk factors that may lead to cataract. So in the next lecture series, we will be dealing the same topic and we will be completing the remaining part of cataract. So I think you all are following up this lecture series. Until we meet next time, thank you.